Hello, my name is Dr. Angela Dunn, State Epidemiologist with the Utah Department of Health. We have made some changes to the public data dashboard at coronavirus.utah.gov. Some parts of the dashboard will look different to you, so we are providing this video to walk through those changes. As always, data can be found by clicking on the Case Counts button on the homepage of the website. Please be aware, the data in this presentation are for demonstration purposes only. For the most recent data, please visit coronavirus.utah.gov. On the overview page, total COVID-19 cases now includes positive results from antigen tests. Like PCR tests, antigen tests tell you if you have COVID-19 right now. A PCR test identifies an infection by detecting viral RNA. An antigen test identifies infection by detecting a protein that is part of the COVID-19 virus. Some labs began using antigen tests in early June. We have reviewed the accuracy of antigen tests and are now including them in our daily count of positive cases. We are also adding data on the number of total tests reported. Previously, we had only been reporting the total number of people tested. But as we have moved further into our response, we are seeing more people who have been tested multiple times. The new data reflect this. The positivity rate will still be calculated by dividing the number of people tested by the number of positive results. Moving down the page, the cases by positive test date and the cases by symptom onset date charts have been collapsed under tabs to preserve space. Clicking on the relevant tab will reveal the chart. For all charts, you can hover your cursor over the chart to see the specific data points. Below these charts, we have added a total test by date chart. PCR and antigen tests will be represented by different colors on the chart. This chart, along with the people tested by date and total cases by date by local health department charts, have been collapsed under tabs. Finally, at the bottom of this page and throughout the entire dashboard are data notes that provide definitions and explanations of how data are compiled and counted. There are no significant changes to the risk factors or hospitalizations and mortality pages. Moving on to the demographics page, we have added charts to depict case rates by age group. As with other charts, hover your cursor over the chart to see specific data points. Moving down the page, we have added data on pre-existing conditions of all cases and all hospitalized cases, broken out by race and ethnicity. Moving to the Trends page, while not new to this version of the public dashboard, the 7-day rolling average charts show the average number of total cases by day and the average percent of positive laboratory results over the most recent 7-day period. This is valuable information for evaluating the current status of what is happening in Utah. There are no changes to the Outbreaks page. We hope you will find the changes to our data dashboard helpful and remind you to visit coronavirus.utah.gov for other valuable information and resources.